What is your name?
Alasdair, Rutherford.
And in which city and country are you based?
In Stirling, in Scotland.
Okay. And what organisation do you work for?
The University of Stirling.
Great. And how would you explain what you do to a layperson?
I'm a research fellow studying ageing, migration and informal care. And so I gather and analyse data about informal caring to inform research and policy.
So Alasdair, what would you say are the sort of three main policy priorities at present for long-term care?
Well, Scotland has a policy of free personal care, which the current administration are committed to continuing. So the preservation and the funding of that, I think, are a key policy priority. That's obviously designed to encourage home care and to allow people to remain in their homes for as long as possible. So I think supporting that is key. Looking at housing and care, I think understanding the impacts of home care, of long-term care policy on the housing market is also important. There hasn't been growth in residential care, partly because of this policy push for home care, and so that means that more older people are staying longer in houses, have more housing wealth, and this has an impact on the housing market, which I think needs to be better understood.
Okay.
Other key policy challenges, changing demographics and ageing population is obviously important. Understanding the effect that's going to have, not just on increased numbers of older people and increased life expectancies, but also on what proportion of that is increased healthy life expectancy, and how long-term care is going to be funded. Who's responsible for paying for it? Whether people are going to be expected to finance it themselves, it's going to be financed through the government or through some form of insurance, and I think that's a key concern for people that needs to be settled.
Okay, great. And to what extent do you think these priorities have changed, maybe in the last 5 to 10 years? Have they changed?
I think in the last 5 to 10 years we've become more aware of demographic change and of that being an issue. I think in the Scottish context, there's obviously been a lot of support for the policy of free personal care and the impact that has on home caring, but there's been a lot more scrutiny of the cost of that as they've increased dramatically. It's cost a lot more than anticipated. So I think there's been increasing discussion of how that should and will be funded.
Great. And how do you see the system, the long-term care system, in Scotland changing in the next 10 years, let's say? Or 20 years, if that's easier.
I suppose the big thing we're going to see in the next 5 to 10 years is whether free personal care is sustainable, and a big factor in that is what happens with Scottish devolution. We have a referendum coming up, and the potential for big changes in a lot of spheres, and so it's really difficult to say what will be possible following that. So I think we'll be watching closely.
Okay. And do you get a sense that the current financial crisis is having an impact on long-term care in Scotland?
I think that the current financial crisis has made people think a lot more about the costs and the cost in the future. There has been some effect, and where spending on long-term care has been protected to some extent. It's administered at the local level and local authorities, and so there's quite a bit of variation as to where cuts have fallen and to what extent long-term care has been affected.
Okay. And if you had the opportunity to introduce one new policy reform in Scotland related to long-term care, what would it be and why?
That's quite a big ask.
It is.
I think one of the elements of long-term care that people feel very strongly about is whether individuals have to pay for it, and whether that has to be financed from the sale of people's property. I think policy suggestions that place a cap on spending on long-term care would go a long way to reassuring people about what the costs are going to be, and feel that the system is fairer. So I think that would have a big impact.
Okay. And how likely is it that you imagine that policy changes could be made in that direction, or to address housing issues?
I think it's possible that could happen. The care has been a fairly big priority for the Scottish Government. It's going to come down to finance and to what changes there are with devolution in the near future.
Okay, did say that, yeah. So in your view, what do you think is the most important piece of evidence that's missing that could help inform long-term care policy in Scotland?
I think in terms of evidence, we need to better understand informal care and patterns of informal care. In particular, going beyond a focus on primary informal carers to thinking about secondary networks of care and support, of thinking about care not just as being one-to-one from between spouses or from children to parents, but as being a network of different individuals, family, friends and neighbours who contribute in different ways, and thinking about how that support is complementary or substitutable, and linking that better to formal care provision, so that there's a mixed package of care.
Okay. And a few quick-fire questions. Just need a response in the form of a number, where 1 is a low ranking and 10 is a high ranking. What policy priority is allocated to long-term care in Scotland?
8.
How aware is the general public about what the long-term care system offers to people in need of care?
5.
Okay. And how well does the system support people with long-term care needs?
7.
How well does the system support the needs of carers?
5.
5. One final question. How integrated are health and social care systems or policies or services in Scotland?
I think integrating health and social care is challenging. They're not very well integrated in Scotland. It's something that people talk about a lot, and I think it is improving. There are certainly moves in Scotland to combine health and social care data, which would certainly help coordination of services and better understanding of those interactions.
So it's somewhat low score somewhere, or?
Sorry, you wanted a score.
That's fine. That's perfect.
Yeah.
No.
Okay. I guess 5.
Perfect. Thanks very much.